Chapter 2, The History of the Social Welfare System and the Social Work Profession. The social welfare system is the collection of programs, resources, and services available to help people. Social welfare services are established through public laws and policies that are typically developed in response to a large-scale social need. These public policies and laws come from federal and state legislatures, local municipalities, and courts. An example of a social welfare program is the SNAP program, or the Supplemental Nutrition Assistance Program, also known as, in the past, as food stamps. When you hear the word welfare, what do you think of? Stop the video here and answer that question, number 1 and number 2, on your assignment. When you are finished answering those questions, then start the video again. How the social welfare system helps people. Social welfare programs can be institutional or preventative, or residual and reactive. Institutional programs address issues before there is a problem. That's why we consider them to be preventative or more proactive. An example of this would be Social Security. Most people pay into this during their working years, perhaps in the form of a money taken out of their check or other ways of paying. And then when they reach a certain age, they are entitled to a monthly payment to help prevent or keep people out of poverty. Another example of an institutional program are tax benefits. Some people might receive tax exemptions for children, or a small tax break for dependents. So those are examples of what would be preventative programs, and we consider these to be institutional. There are also residual programs, which are more reactive. This is when there is a problem that is present, and these programs seek to address identified problems. An example of this would be cash assistance, and also the SNAP program that we had referred to before. Most programs in the United States are residual. For residual programs, an individual has to have documentation that there is a need and all of their other resources are lacking. The major social welfare programs that exist in the United States are cash assistance, in-kind benefits, entitlements, public assistance programs, and social insurance programs. Cash assistance programs are the provision of services through financial transfers. In-kind benefit programs and entitlements fall under cash assistance programs. In-kind benefit programs are aid in the form of tangible items, and these can only be used for specific services. So an example of this would be housing assistance, like vouchers for rent, or with the SNAP program, food stamps, as it has been referred to in the past. Entitlements can come in the form of cash assistance or in-kind benefits, and individuals are guaranteed help if they meet certain requirements. Cash assistance programs consist of the transfer of money from the government to a person in need, and the level of financial need has been determined, and typically an individual would receive a monthly check. And then with cash assistance, the recipient determines how to spend that money. Other social welfare programs consist of public assistance programs, which seek to alleviate poverty. Examples of this is TANF, which is the Temporary Assistance for Needy Families, Medicaid, SNAP, again, food stamps, and public housing. Social insurance programs seek to prevent poverty, but benefits are available regardless of one's income level. Again, an example of this would be Social Security, Medicare, unemployment insurance, and workers' compensation. We will discuss all of these programs and benefits and different types of assistance in more detail in class.